Imagine you live in a country where a family lives on $1 a day. You see a doctor only when you are very ill. The nearest health facility is 5 to 10 miles away. And the only available transportation is either by public transportation, bicycle, a donkey, a horse, or your feet. Unemployment is 70%. Formal education in rural areas and for some groups is a myth. You wake up one day, there's civil disobedience, and thousands of people are displaced and have to adjust to a new life in a refugee camp, which can last between 10 and 20 years.
A refugee is someone who is outside of their country. They've been forced out of their country due to persecution, or it can be race, religion, nationality, or it can be a member of a particular social group. So basically, they cannot go back to their country of origin.
I have a terrible experience of living in refugee camp for almost 2 decades, 20 years. We are given a small house to live. We were provided education by the Caritas Nepal. We had medical facilities where we can go and have treatments for the simple things only, not majorly. And basically we have like a hard life, but we made it throughout the 20 years with the help of all different international organizations. And finally I moved to the United States with resettlement process.
Finally, the day you have been waiting for arrives. Through the United Nations, you are being relocated to the United States of America. Coming to the United States of America does not come without hardships. Now you have to learn to get around and find a job, something you've never done in your life. You also have to learn a new language or depend on your children, family, friends, or total strangers.
The problem with a refugee or an immigrant is language, but it's culture too. It's intertwined. You can interpret, if you have an interpreter, word for word it from English to another language, but they may not even know what you're talking about. There's no context.
At first, there were challenges everywhere in our life, like understanding the rules and regulation, like going out for grocery shoppings, running like common utensils for our basic needs inside the house, taking up public transportations, understanding about the educations and going for college and schools. Especially we do have a common problem of having like a communication barrier, like not having enough conversation to understand one another.
Before we start providing health care or any sorts of support to somebody else, I think it is good to learn something about who they are and how they are and what sort of treatments they used to receive and how we need to serve them.
This is one of the bigger challenges because from the backgrounds they come from, many of them, they don't have those kind of health facilities available and we don't have their health records available. Once they come here, they may have some language barriers, they have cultural barriers. And in the hospitals, once they come, we see sometimes they are not comfortable, they are scared, they are afraid of, and from the health professional standpoint, sometimes we don't see those kind of cultural sensitivities.
In addition, you have to navigate the healthcare system and talk to strangers about personal and private issues you would not even discuss with your family members. What will you do? How will you feel? Why would your healthcare provider be interested in your welfare?
I have a hard time understanding the American healthcare system. Somebody who's coming from a refugee camp where there hasn't been a system or a system that's been very overrun with very few resources is definitely not going to understand what's happening here.
When you are speaking to a patient who doesn't necessarily speak the same language as you, or if you don't speak, if your first language is not their first language, it's important to make sure that they understand what you are telling them and to take the time to make sure that what you are trying to convey to them is what they got out of the encounter.
What happens is when they go to the doctor, they don't share a lot of information, so they just sit there and they wait the doctor just to give them prescriptions. especially this is influenced by their country of origin. The doctors, they're seen as very powerful, and if they say something, that the patient has to abide by it. And when they see the doctor and the doctor says something, they don't question what the doctor says, or they don't ask for a clarification or explanation.
For example, in females, sometimes they refuse to just be exposed. It's just the matter of that the Islamic faith doesn't require females to get exposed in general interactions, but for medical reasons, Islam does allow that if the health professional, health provider, a doctor needs to see a patient, as a male or a female, under those circumstances, they should be able to see and treat that patient. That's permissible.
To explain what they're doing is very important. If somebody does not have the knowledge about you or the English, don't speak the language, you should get an interpreter and explain to each one of them what you're doing with them. And I want to say, for me, to get a woman, to always have a woman doctor to take care of them if they really don't feel comfortable about you.
It's very important to explain to every medical providers what we people are and where we are from, understanding our religion, our practice, and understanding the problems, like the way of explaining our pain or the problem to the doctors. So we need like extra effort to make our people more comfortable about getting their benefits in medical healthcare.
This is the story of many immigrants and refugees that live in our community and come to us and depend on UPMC for their care. We have to be compassionate with the care we provide them and treat them with dignity and respect because we care.